During the course of our work, we will come across patients who will have both an alcohol use disorder as well as a depressive disorder. In this module, we'll learn how to deal with such patients. In such patients, the two disorders could be unrelated to each other. On the other hand, there could be a relationship between the two. For example, the patient might drink because of his depression to reduce or forget the symptoms of depression, or the depression by itself might be a result of his or her heavy drinking, as it is very well known that heavy drinking can cause depression in some people. However, most of the times, it is difficult to pinpoint the exact relationship between the two. We will come to know whether a patient has both a drinking problem and a depressive disorder based on the results of the screening. Any person who has an audit score which indicates alcohol use disorder and a PHQ-9 score which indicates a depressive disorder will have coexisting alcohol use disorder and depressive disorder. The next question is, which one do we treat first, the alcohol problem or the depression? Generally, the evidence suggests that if we treat the alcohol problem first, the depression will go away by itself. Hence, for everyone who screens positive for both disorders, we'll treat the alcohol problems first using the CAP approach. If we are successful and the patient reduces or stops his or her drinking, we might find that the symptoms of depression reduce automatically. Next is what to do after completion of delivering CAP. What we should do is to screen the patient again for depressive disorder. If we find that the symptoms of depression persist, we should then refer the patient to a psychiatrist for appropriate treatment. Although you have been trained in counseling for both depression as well as alcohol use disorders, using both of them together is a complex process for you and confusing for the patient as well. Hence, it is important that we avoid using both these counseling methods at the same time for the same patient. Finally, a small proportion of patients with alcohol use disorders and depression will not be able to engage in CAP treatment because of their severe depressive symptoms. If we think that one of our patients fits these category, we must refer such patients to a senior clinician, usually our supervisor, so that he or she can decide what to do with that patient, as such patients generally require more specialized treatment.